It's alarming to see how quickly the United States is grappling with yet another unsettling rise in COVID-19 cases. A fresh wave of infections has taken hold, and this time it's centered in a cluster of states that are now being labeled as the latest hotspots. But here's where it gets concerning. Experts warn that the official numbers might only scratch the surface of what's really happening on the ground. As of late August 2025, data indicates that more than a dozen states are witnessing a worrying uptick in positive cases. The most intense surge is concentrated in a 5-state region spanning Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. These areas have become the epicenter of virus activity, with 15% of all COVID tests coming back positive, a figure that should raise eyebrows. However, many health professionals argue that the actual case count could be far higher. Why? Because an increasing number of people are opting for at-home testing kits rather than seeking lab-based diagnostics, which means their results often go unreported. This shadowy gap between confirmed cases and reality makes tracking the pandemic even trickier. But wait, there's more to unpack. Beyond the South Central states, the entire western half of the country is also seeing a notable spike in infections. In fact, about a dozen additional states are reporting positivity rates hovering around 10%. And let's not forget, these statistics don't exist in isolation. They're part of a broader pattern that has emerged every summer since the start of the pandemic. As temperatures climb, so do interactions among people. Whether it's through travel, gatherings, or simply spending more time indoors in air-conditioned spaces. All of these factors create fertile ground for the virus to spread. This resurgence comes at a particularly contentious moment. Robert F. Kennedy Jr., a prominent figure in public health debates, recently announced plans to push for a ban on COVID vaccines within months. While his intentions may stem from concerns over vaccine safety, critics argue that such a move could put vulnerable populations at greater risk. Is this bold proposal a step toward reform or a dangerous amble? That's a question worth debating. Meanwhile, behind the scenes, there's turmoil brewing within the Centers for Disease Control and Prevention, CDC. Several top officials have resigned, accusing former President Donald Trump of politicizing public health measures during his tenure. Their departure signals deep rifts within an agency tasked with safeguarding the nation's well-being. Adding fuel to the fire, the current CDC director was abruptly removed from her position after less than a month, sparking widespread speculation about the future direction of the organization. In an effort to better understand the scope of the outbreak, researchers are turning to unconventional methods like wastewater monitoring. This technique involves analyzing sewage samples to detect traces of the virus, providing early warnings before clinical tests pick up on outbreaks. According to recent findings, 5 states, Alaska, Hawaii, Nevada, Texas, and Utah, are showing very high levels of viral activity based on wastewater data. The CDC explains that this method can identify asymptomatic carriers and track community transmission long before individuals seek medical care. It's a fascinating approach, but one that underscores just how pervasive the virus remains. And this is the part most people miss. Immunity isn't necessarily permanent. Dr. Ziad Al-Ali, a leading epidemiologist at Washington University in St. Louis, pointed out that those who received their shots last fall may already be experiencing waning protection. This revelation raises critical questions about the durability of vaccines and whether booster campaigns will need to be revisited sooner rather than later. On a related note, the Food and Drug Administration, FDA, has approved updated versions of the Moderna, Pfizer, and Novavax vaccines, specifically tailored for seniors. However, access for younger adults and children without underlying conditions has been scaled back. What does this mean for families trying to stay safe? Will narrowing eligibility criteria hinder efforts to curb the spread? So, what's your take? Do you think we're doing enough to address this latest surge, or are we missing crucial opportunities to prevent further crises? Share your thoughts in the comments below. We'd love to hear your perspective.